Could the way you sleep tonight quietly put your health at risk? If you're over 70, one common sleep habit, something many people do without thinking, could be affecting your circulation, your breathing, and even your heart while you rest. In this video, we'll uncover why sleeping with your arms above your head might be far more dangerous than it seems, especially as we age. You'll hear real stories, learn what the science says, and discover the simple steps you can take to protect your health while you sleep. Because sleep should restore you, not put you in danger. Let's get into it. What happens to the body during sleep at 70 plus? Did you know that something as simple as the way you sleep, just where you place your arms, could quietly raise your risk of serious health problems? Most people don't think twice about how they lie in bed. After all, sleep is supposed to be restful, harmless, healing. But what if I told you that for those of us over 70, certain sleep positions might do more harm than good? I didn't believe it myself until it happened to me. It started about 3 years ago. I would wake up with this strange numbness in my left hand. Not pain, just a dull, tingling sensation, like the feeling you get when your arm falls asleep. At first, I thought I had just slept funny, but it started happening more often. Sometimes it was both hands. Sometimes my shoulders felt sore. And one morning, I woke up gasping, heart pounding with a strange pressure in my chest. It passed quickly, but it scared me enough to finally talk to my doctor. We had a long conversation. He asked about my sleep, not just how long, but how I was positioned. I told him that I usually slept on my back, sometimes with my arms raised over my head or folded behind the pillow. It had always been comfortable. I'd done it for decades. He frowned. "You might want to stop that," he said, "especially now." And that's when I learned the hard truth. After 70, your body changes. You know this already. Your joints are stiffer, your circulation is slower, your muscles don't respond like they used to. And during sleep, when everything relaxes, your body becomes even more vulnerable. Lying with your arms above your head might not seem like much, but it can create pressure on critical nerves and blood vessels, especially if you stay that way for hours. Your shoulders weren't designed to be in that position all night. When you raise your arms up and fall asleep, you compress part of the brachial plexus. That's the nerve network that controls your arms and hands. You can also press against arteries that supply blood to your limbs and, in some cases, reduce flow back to your heart. This is especially risky if you already have any of the following: arthritis or shoulder degeneration, poor circulation, heart conditions, sleep apnea, diabetes, which affects nerve sensitivity. But even if you feel healthy, your body doesn't recover the same way after 70. That tingling I felt in my hand, that was my body warning me. Think about it. If your hand goes numb during sleep and you don't notice, because you're asleep, you could stay in that position for hours. And over time, that can cause real damage. There are cases, real ones, where people have woken up with nerve damage or worsened blood pressure conditions simply from repetitive strain while sleeping. So I changed how I slept. I started using a pillow under each arm, just slightly elevated. I trained myself to sleep on my side with a body pillow. And guess what? The numbness stopped. The pressure in my chest hasn't come back. We talk a lot about diet, about walking more, about seeing the doctor. But we rarely talk about sleep positioning, and yet we spend a third of our lives asleep. So if you're over 70 or approaching it, I want you to start thinking about how you sleep. Not just how much, but how. And if this kind of real-life insight and practical wisdom speaks to you, please take a moment to like this video and subscribe to Glowing Age. We share the kinds of conversations most people aren't having, but absolutely should. I'm not trying to scare you, but I am trying to wake you up before something else does. So tonight, when you lie down, notice your arms. If they're above your head behind your pillow or stretched too far, gently bring them down. Use a soft pillow to support them. Try keeping your hands near your chest or stomach. It might feel strange at first, but your body will thank you, because small changes, especially while you sleep, can make a big difference in how you feel when you wake up. Don't wait until the numbness comes. Don't wait until your chest feels tight. Don't wait until a doctor has to explain what could have been prevented. Start now, because even in sleep your body is speaking. The question is, are you listening? The physiology of raising arms overhead in bed. Let's take a closer look at what actually happens to the body when we raise our arms above our head in bed. Because it's more than just a question of comfort. For most of our lives, we think of raising our arms as something harmless. Stretching in the morning, reaching up to grab something, even lounging in a recliner with hands behind the head. But when you fall asleep like that and stay there for hours, that's when problems start, especially after 70. You see, your shoulders, neck, and chest form a delicate passageway for several major nerves and blood vessels. There's a reason the body isn't designed to hold that overhead position for long stretches. It wasn't made for it. Not without movement, not without breaks. When you sleep with your arms above your head, particularly on your back, two things are happening that doctors worry about. First, you increase tension on the brachial plexus, the nerve bundle that controls your arms and hands. Over time, that tension can lead to numbness, tingling, or even weakness. Second, and more seriously, you risk compressing arteries in your shoulders and chest, most notably the subclavian artery. This is the main route for blood to travel from your heart into your arms. If you cut off or reduce that flow during sleep, your limbs suffer, and your heart has to work harder. That can lead to irregular heart rhythms, dips in blood pressure, or worse. And because you're asleep, your body can't correct the position like it would during the day. You're not conscious. You don't shift every few minutes. In fact, the older we get, the less we move during sleep. So what does this mean for someone over 70? It means that sleeping with your arms raised, especially for long stretches, can quietly contribute to problems that feel like they come out of nowhere, like dizziness, arm weakness, morning headaches, or even chest discomfort, all linked to something as simple as posture. And we haven't even talked about the impact on breathing yet. When your arms are raised, it changes the angle of your chest and rib cage. For some, this can narrow the airways slightly, enough to make sleep apnea worse or to disrupt deep breathing. If your breathing is already compromised due to age, weight, or a heart condition, this added restriction can push your system too far. And when that happens, when oxygen dips and your heart rhythm gets disrupted during sleep, that's when the risk of sudden cardiac events increases. It sounds dramatic, but it's not just theory. Doctors have linked poor sleep posture to a range of nighttime complications. That's why I started paying attention. Now I use pillows to gently cradle my arms at my sides. If I'm lying on my back, I place a small cushion under each elbow, angled slightly so my arms rest lower than my shoulders. If I'm on my side, I keep one arm in front of me, not overhead. It took some getting used to, but I sleep better now. And I wake up without that pressure in my shoulders or the tingling in my fingers. If you've noticed your hands going numb at night, or if you wake up with sore arms or neck tension, this could be why. So many of us grew up never thinking about how we sleep. But your sleep setup matters. After 70, your body doesn't bounce back the way it used to. What used to be a minor kink in the neck becomes a chronic issue. What used to be a moment of discomfort can turn into weeks of therapy. Raising your arms might feel innocent, but your nerves and blood vessels are working hard to keep you alive while you sleep. Don't make their job harder. Instead, make small adjustments. Be mindful, support your body. Because rest isn't just about sleep, it's about safety. And the more you know, the better you sleep, not just longer, but healthier. Restricted blood flow and nerve compression. Let me tell you what really opened my eyes. It wasn't just the numb hands or the sore shoulders. It was the day I stood up after a nap and nearly blacked out. My vision blurred, my knees buckled. My heart was racing like I'd been sprinting. What had I done before lying down? Nothing unusual. But that time I had taken a long nap with both arms stretched above my head. That was the last time I ignored what my body was trying to say. Here's the truth. Raising your arms above your head, especially while sleeping, can restrict blood flow more than you might realize. It's not just about numbness. It's about circulation. When you sleep in that position, you're compressing parts of your shoulder and collarbone region where blood vessels pass through narrow spaces. That includes the subclavian artery and vein, which run just behind your collarbone. If your shoulder is angled just the wrong way, or held in that position too long, those vessels can be pinched. That can reduce blood flow to your arms. But worse, it can also affect how blood returns to the heart. That means less oxygen delivery, more strain on your heart. And over time, the risk of fatigue, dizziness, or even irregular heart rhythms increases. Now, this isn't just a guess. There's a real condition called thoracic outlet syndrome, where nerves and vessels get compressed between the collarbone and first rib. It's more common than most people realize, especially in people with poor posture or arthritis. And while it often shows up during the day, from activities like reaching overhead or driving with poor posture, it can happen at night too. Especially if you're sleeping in that raised arm position without any muscle engagement to protect the area. And you don't even have to have thoracic outlet syndrome to be at risk. If you've got narrow arteries, poor circulation, or a slower heartbeat from medication, or just from aging, your body is already working harder to keep blood moving. Add in compressed arteries or veins for 6 to 8 hours every night, and over time that can cause cold hands and fingers, swelling in the arms, tingling or burning in the skin, fatigue during the day from disrupted blood flow at night. Even more alarming, studies have shown that poor circulation during sleep can lead to nighttime arrhythmias, irregular heart rhythms that can quietly increase the risk of stroke or sudden cardiac events, especially in people over 70. So what can you do? Start by noticing how you feel in the morning. Do you wake up with tingling in your hands, sore shoulders, a fast heartbeat, lightheadedness? That might be your clue. The solution isn't complicated, but it does require intention. Instead of letting your arms drift overhead, support them. Try placing pillows at your sides. If you sleep on your back, keep your arms bent gently at your sides or across your stomach. If you sleep on your side, hug a pillow. These small changes protect your circulation, and they can make a big difference. I've talked to people who didn't even realize they were sleeping this way until they started waking up more tired than when they went to bed. The fatigue, the headaches, the stiff arms, it all came back to one thing: blood wasn't flowing properly overnight. So tonight, do a little check-in before bed. Lie down, notice your arms. Where are they resting? Do they feel supported, comfortable, or stretched and strained? And if this story and advice are helping you connect some dots, please like this video and subscribe to Glowing Age. You never know who else needs to hear it. Because circulation isn't just about your heart, it's about how your whole body thrives or struggles. And the older we get, the more we need to protect the systems that protect us. So keep your arms in a healthy position. Let your blood flow freely, and let your rest be what it's meant to be: restoring, healing, and safe. Sleep apnea, positional breathing issues, and sudden cardiac risk. If you've ever woken up feeling like you didn't sleep at all, even after 7 or 8 hours, it might not be your mattress. It might be how you're breathing while you sleep. And for many older adults, that poor breathing is tied to something simple: sleeping with your arms above your head. Now you might ask, what do my arms have to do with my breathing? More than you think. When you raise your arms, especially if you're on your back, it pulls your shoulder blades up and back. That might seem harmless, but it subtly shifts the structure of your chest and upper airway. For someone under 40, that's rarely a problem. But after 70, with stiff joints, weaker muscles, and a more fragile respiratory system, that shift can do two dangerous things. It narrows your upper airway. It reduces your lung expansion. Why does this matter? Because many seniors already have some degree of restricted breathing during sleep. Sleep apnea, shallow breathing, or nighttime oxygen drops become more common with age, even if you've never had problems before. When your airway narrows and your lungs can't fully expand, your oxygen levels fall. Not always enough to wake you up, but enough to put strain on your heart, your brain, and your overall energy levels. And here's where it gets more serious. Studies have shown that low oxygen at night, especially repeated drops, can lead to arrhythmias, irregular heartbeats, high blood pressure, and even sudden cardiac events during sleep. It's what some doctors quietly call silent suffocation, when your body is struggling for oxygen but you're asleep and unaware. Now, sleeping with your arms overhead doesn't cause sleep apnea, but it can make it worse, much worse. I spoke to a retired nurse once who told me, "We had more than one patient come in after a nighttime scare, gasping, lightheaded, pale. And it turned out their breathing was being affected by how they were sleeping." This isn't meant to scare you, but it is meant to get you thinking. If you're waking up tired with a dry mouth, a racing heart, or headaches, it might be time to look at your sleep posture. Not just your pillow or mattress, but where your arms are. Because raising your arms above your head stretches the muscles around your rib cage. That might feel like a nice stretch during the day, but at night, it can subtly flatten your breathing pattern. And for some, that's enough to trigger a drop in oxygen. So how do you fix it? Use a pillow under each elbow if you sleep on your back. If you sleep on your side, keep your lower arm bent gently in front of your chest. Hug a pillow. This keeps your upper arm from drifting upward. Avoid propping your hands behind your head or tucking them under the pillow. These small adjustments help keep your chest open, your airway clear, and your breathing smooth. If you've ever felt like you wake up with more fatigue than when you went to sleep, or you've noticed odd dreams, night sweats, or a pounding heart, it might be more than just age. It might be a subtle drop in oxygen. The body is wise. It gives us clues, we just have to pay attention. Because when you sleep right, everything else, from your mood to your memory, gets better. Let your body breathe, and give your heart the rest it truly needs. Real cases and clinical observations. Let me tell you something that really stuck with me. A story from a sleep technician I met during a health workshop a few years ago. She said, "You'd be amazed how many people come in with complaints like chest tightness, hand weakness, or nighttime panic. And it turns out they've just been sleeping wrong. We see it over and over." That got my attention, so I started asking around, quietly of course. I spoke to a few older friends, folks in their 70s and 80s, and sure enough, many of them had had similar experiences. One man told me he woke up one night feeling like his entire left side had gone numb. He panicked, thinking it was a stroke. It wasn't. But after a night in the hospital, the doctor told him he had simply been sleeping with his arm pinned above his head against a hard pillow. The pressure on his shoulder and neck had compressed the nerves and restricted blood flow. It took 2 weeks for the tingling to go away. Another friend, a woman in her mid-70s, said she often woke up with her heart racing and her arms weak. Her doctor ran tests and nothing showed up until they did a sleep study. Turns out she had mild positional sleep apnea. Her breathing was being disrupted by the way she cradled her head with her arms overhead. It wasn't enough to stop her breathing, but enough to lower her oxygen and trigger heart rhythm changes. These are real people, real stories. The more I heard, the more I realized this isn't rare, it's just rarely talked about. Doctors notice patterns. And in the last decade, sleep specialists, physical therapists, and even cardiologists have all started pointing to sleep posture as a hidden factor in a lot of age-related health concerns. That's especially true when it comes to older adults who wake up feeling weak or dizzy, experience tingling or pain in their arms or fingers, struggle with stiff shoulders or necks in the morning, report random chest pressure that disappears quickly. All of these can be linked back to nerve compression, blood restriction, or poor respiratory mechanics caused by awkward sleeping positions, particularly with the arms above the head. Now, I'm not saying every strange symptom is caused by how you sleep, but I am saying this, it's one of the easiest things to change. And if changing it helps, that's worth everything. So what do the experts recommend? Train your arms to rest below your shoulders. Use pillows or rolled towels if needed. If you sleep on your side, keep your arms in front of your chest, not above your head. On your back, place your arms at your sides or gently over your abdomen. Avoid sleeping with your hands behind your head or tucked under your pillow. It may feel cozy at first, but strains your nerves and vessels. These aren't complicated fixes, but they take mindfulness. And I'll tell you from experience, once you make these changes and get used to them, you sleep better, you wake up clearer. The little aches and odd sensations fade away. And if you're finding this helpful, please like this video and subscribe to Glowing Age. This isn't just information, it's shared wisdom, the kind that could quietly add years of comfort and safety to your life. We don't always need a prescription. Sometimes we just need to pay attention to what our body is trying to say. And sometimes it's as simple as where we rest our hands at night. Safer sleep positioning tips for seniors. Now that we've covered the risks of sleeping with your arms above your head, let's talk about what to do instead. Because here's the good news. The solution is simple, gentle, and easy to start tonight. You don't need expensive equipment. You don't need a new mattress. What you need is awareness and a few small changes to your bedtime routine that can make a big difference in how you sleep and how you feel when you wake up. Here's what I've learned and what's worked for me. One side sleeping with a body pillow. If you're someone who likes to curl up, try placing a full-length body pillow in front of you. Wrap your top arm over it and rest your lower arm underneath or slightly in front of your chest, not overhead. This gives your upper body something to hug, which keeps your arms in a supported, natural position. 2. Back sleeping with arm support. If you sleep on your back, you want to avoid letting your arms float up or fall to awkward angles. I place small pillows or rolled towels under each elbow. This keeps my arms gently bent, resting comfortably at my sides. You can also rest your hands on your belly or use a small wedge pillow to prevent them from drifting. 3. Mindful pillow placement. Where your pillow sits under your head can affect your arms too. Make sure your pillow supports your neck but doesn't encourage you to fold your arms behind it. If you tend to tuck your hands behind your head, try sleeping with a second pillow under your arms instead. It gives them a place to land. 4. Create a pre-sleep check-in. Before you close your eyes, pause and scan your body. Where are your arms? Are your shoulders relaxed? Are your wrists bent awkwardly? Adjust gently. That extra 30 seconds can help train your body to adopt better positions without even thinking about it over time. 5. Use sleep cues and gentle restraints. One tip I learned from a physical therapist. If you constantly wake up with your arms overhead, try loosely wrapping a small blanket around your elbows while you sleep. Not tightly, just enough to give your brain a reminder, Over time, your body learns not to drift into that position. These small habits changed my nights. I no longer wake up with numb fingers. I breathe easier. I feel clearer in the morning. And I know I'm protecting my heart, my brain, and my circulation with every good night's sleep. Doctors may not always talk about sleep position, but the ones who work with older adults know it matters. Here's a simple recap you can follow tonight. Use side pillows to support your arms. Avoid overhead or behind the head arm positions. Keep arms slightly bent and below the shoulder line. Do a quick posture check before you fall asleep. It might feel different at first, but it will feel better in the long run. And better sleep doesn't just mean more rest, it means better circulation, better breathing, better mornings, and maybe even more years to enjoy those mornings. So tonight, do something simple. Give your arms a better place to rest, because a small change in posture can be a big step toward a healthier future. A good night's sleep doesn't just depend on how long you rest, but on how you position your body while doing it. Now you know how raising your arms can affect your nerves, your blood flow, your breathing, and even your heart. But you also know what to do about it. Support your arms, adjust your sleep posture, and build habits that protect you through the night. If this video helped you feel more in control of your health, please like it and subscribe to Glowing Age. We're here to turn quiet risks into clear action, so you can age with more knowledge and confidence. And I'd love to hear from you. Have you noticed arm numbness, breathing issues, or sleep struggles that might be linked to your position? Let's share and learn from each other in the comments. Because restful sleep shouldn't come with hidden danger, and you deserve to rest wisely.